Of course, our next speaker is going to be talking about communicating with the public about COVID-19. New Zealand's Director General for Health, Dr. Ashley Bloomfield.
Kia ora koutou katoa. Thank you very much for the opportunity to present and talk with you today. And I'm sorry I was a little late joining the call, but many thanks to Marissa for being flexible and taking that first slot. And I just, as happens in this job, got a call from the Minister's office I needed to take. So look, I just want to share a few thoughts about communications and the role that communication with the public has played in our COVID-19 response to date. Share a few reflections, and I'm very interested in your questions and comments as well, and the time we've got. So we all know that that communication is a critical sort of public health strategy, whether it's in an emergency or emerging situation, or as part of any public health program, whether it's a program like immunisation, a screening program, whether it's a disease control program, a non-communicable disease control program, or a communicable disease control program. And I guess the two overarching purposes, I guess, or goals of that communication are to communicate with the public effectively about risk and what they can do about that risk, or how to think about and manage that risk. But also, and I think this is a point I really want to draw out, is the communicating with them about the why, about why it's important and why it is they may need to act. Because in any public health program, we're asking people to do something really, and usually do something different from what they're already doing. And if they understand the why, we all know they're more likely to do that. So we have this elimination strategy for COVID-19. It's evolved pretty rapidly as we've gone along since we started our response in late January. And that elimination strategy, which is on our website, talks about these 4 pillars around the border, particularly preventing further cases coming into the country. There's the need for rapid case finding and testing. Then there's the contact tracing, and then there's the sort of maintaining public trust and understanding. And I guess across all of these, communication is important, but that last pillar is one we can't afford to lose any momentum on. So as this COVID-19 situation evolved in New Zealand, and we responded pretty quickly at the Ministry to stand up a National Health Coordination Centre. And very early on, I think it was early February, my team said to me, why don't you start doing a daily stand-up? And in part, they had an ulterior motive there, because they were getting huge numbers of media inquiries every day, as we do in this organisation. And one of the ways to manage those inquiries was for me to start doing a stand-up and answer questions or gather questions that we could come back to on the next day with any information we had. So it was great advice from a very experienced comms manager here, who's been here for a long while, Peter Abernathy. And so we started doing the daily stand-ups in a little room in the ministry with a small number of journalists who kept showing up every day, mostly the health journalists from the various agencies. And what I soon realised was actually, because there was so much uncertainty about the evidence and information was evolving and knowledge was evolving so rapidly, this actually, and because of that, there was a lot of speculation, a lot of misinformation out there. This gave us a really important direct channel to the public where we could convey our messages. And because the journalists were actually either live streaming the stand-up or effectively typing their story directly onto their website as we went, it gave us an opportunity to get really clear messages out to the public without the sort of journalistic filter in a way. I'm sure they might go back and write a story about something, but in the present, we could get our messages out there, and that became really important. And what I think it helped with is, because I was doing those stand-ups with support from Caroline McElnay, the Director of Public Health, it was the health professionals and the people bringing the science to the issue who were, at least for the first while, making those or communicating with the public. And we had, of course, a lot of other commentators, including scientific commentators, and some, many of them colleagues like Michael Baker, Nick Wilson. We had Susie Wiles. We had various others making comments or writing commentary in the media. And more often than not, our commentary would converge, but sometimes there were points of difference. But what the public saw there, I think, was a contest of the interpretation of the evidence, rather than a political filtering of different of the evidence. And so they could see that it was the different scientific perspectives interpreting the evidence, possibly in different ways, but as knowledge emerged, then generally converging. We also were in a situation where the evidence base was so sparse and the knowledge was emerging so quickly on a day-to-day basis that we were able to let the public know what was happening as that evidence emerged, and also put to bed anything that might be a rumour or hearsay or misinformation. But I think a key role that those early stand-ups played was in essentially establishing a relationship of trust with the public. So that by the time we got to into March, and particularly to the big sort of the critical day on the 19th of March, where the Prime Minister announced the alert level framework that many of you will be now very familiar with, and I think it was in a way an inspired piece of risk communication for the public, and it laid out for people, here's where we are and here's what you can expect probably in the future if things keep going the way they are. And the Prime Minister said, look, we're currently in alert level 2, but we might need to go up alert levels, and here are the sorts of things we would consider if we were going to. So then the public knew what was likely to happen and could start to prepare themselves for that. Of course, it was only a very few days later, on the following Monday, that Cabinet made a decision and the Prime Minister announced the country needed to go immediately to alert level 3, and then just a couple of days later signalled that just a couple of days later we will be going to alert level 4, so also known as lockdown, which I'm sure you will all remember well. And interestingly, the public feedback, and we were surveying both through our health and wellbeing surveys, but also the government's all of government comms team was getting surveys of the public about whether they supported the measures the government was taking. And through that lockdown period, there was this incredibly high level of support. 92% of people supported the measures that the government had taken, including the decision to go into what was a very stringent lockdown. So there was this strong support and this high level of trust and confidence in the measures that had been put in place. And again, I think the key thing here was that the public had been prepared, so that when it got to a situation where essentially we were asking people to do things that were impacting enormously on their lives and livelihoods, they understood the why not just the what and the how. So I think in that collective understanding of the why, we saw actually the benefits of that lockdown were more than we thought they might have been, because in very large part New Zealanders owned and cooperated with the expectations that were put on them. And I think that we were all somewhat surprised as we came out of alert level 4 into alert level 3 and started to see that not only had we sort of broken the chains of transmission, but we had achieved more than we might have hoped we would have. So I think that was very important. So we came down through the alert levels. We continued that regular communication with the public about what was happening. They could see the fruits of their collective efforts, and the Prime Minister, who is a very good communicator in her own right and has an excellent team around her, and they're constantly getting feedback from and surveying the public. So they had these very well and carefully crafted messages, and simple messages that people could relate to, and people knew what was happening. And one of them, of course, was the team of 5 million. So people felt a sense of ownership. And I think one of the key bits of feedback I've had from members of the public and many New Zealanders who have communicated with me from all walks of life is that those daily briefings became almost, because people were confined to their bubbles, another very clever idea, to their bubbles at home. This was the way that they felt connected to the wider effort, that they knew all at the same time what was going on and what to expect next. And I think that was a critical part of being able to communicate effectively with the public to enable a really, really good public health response. So we came down through the alert levels, and you'll all be aware of the pressure that then came on. And of course, there was that 1 minute it's we need to go into lockdown, or we didn't go into lockdown soon enough, and then the pressure was on to come out of lockdown apace. I think we've struck a good balance there. But of course, then you get into the situation we found in the last couple of weeks, and I've been, as you will all be aware, somewhat in the spotlight in that regard, is when things don't go perfectly. What happens, and again, I've taken the approach of, and it I think is helping, of continuing the same approach that we started right from the outset, to front up, to present the information, to answer questions, as a way of making sure that we are maintaining trust, which will be the critical part of us continuing to have a really effective response. Because even though I think many New Zealanders have felt, look, we're past this, we're through COVID-19, what's next? And when can we see the All Blacks play? We clearly are not. This pandemic rages off our shores and is gathering pace off our shores. And I think the events of the last 2 weeks, whilst I've had some days that have been more comfortable than others, and some extremely uncomfortable, what it has reminded everybody is that we are still in a really, really challenging global public health situation that we need to keep our eye completely on the ball around. So just in summary, I guess, and I don't want to present for too much longer because I'm interested in the subsequent cordial, but three things really. One is that importance of communication as part of the public health response in establishing trust, and through that trust, I think we were able to, or building on that trust, it was a fundamental part of our effective response. The second thing is the communication, and the regular communication and building off that trust was people understanding the why. And I think this is something we sometimes overlook in our public health programs and the communications that go around that. It's not that here's the evidence, here's what you need to do. It's really connecting with people around the why. And the third thing is that really, this is the no-brainer, but communications people the world around will say this, and you saw this, I think, through the COVID-19 response here today. There's those simple messages repeated frequently through a wide range of channels. And one of the interesting things that happened, we found through the surveys, through the lockdown, is that people shifted from social media as their main trusted form of communication back to the traditional media. And that was, I think, because of those daily briefings playing such an important role in people's in people knowing what was going on, and also knowing what was expected of them. So I'll leave my kind of talk or comments at that, and look forward to your responses and questions.
Thank you, Dr. Bloomfield. As you can imagine, there are quite a few comments and questions. The first one is a comment, just to say, I think you and the Prime Minister have done an excellent job regarding communicating with the public about COVID. You were transparent, open and present. I felt well looked after. Thank you. And then a question, Dr. Bloomfield, as an expat living in Melbourne, I have enjoyed and been extremely proud of the efforts you and your team have made. You mentioned the importance of trust and its fragility. What has been the most challenging aspect of building and maintaining trust with the public?
Oh, thanks for that. Thank you very much for the first comment and the feedback. And Look, this has been really critical, and the big challenge is, and I think this is one where we have done, and what that has laid behind the effectiveness of our response there, was trying to take as much as possible, take the issues out of the political arena, and just to reflect on the effectiveness of a response. And there's been quite a lot of there was quite a lot of focus on were we well prepared. And of course, it's really clear there are things that we could have done better to prepare, and people will be aware of this Global Health Security Index review that was done last year. I think Johns Hopkins and another centre that rated New Zealand's preparedness at around 35th in the world. And of course, topping the chart was the US and UK. But what's become apparent, I think, in all countries' response is that the ability to take the response and out of the political arena, or at least so that the political imperatives are not the main driver of the response, is fundamental to being able to establish that public trust. And I think one of the things we saw here was certainly, with a few exceptions there, through most of the response, there has been this ability to not politicize it. Just finish with this comment that you can be as prepared as you like, but if you don't have good governance, it is all for naught. Fundamental to an effective response are leaders and a political system that quite clearly have the well-being of citizens as the foremost consideration, not personal agendas or political agendas, or indeed egos.
Thank you. Another one. Thanks for all your work, Ashley. Did you find it hard to balance communicating the science and the scientific principles through the media whilst making sure that it's easy for the public to understand?
Well, yes, I certainly did. And I've got a really good comms team here. And as I said earlier on, the Prime Minister herself is a very good communicator. She's well known for that, and she's got a good team around here. And I should point out that every day we would, I would prepare for some time before going on to make sure I had all the information and we had worked through the messages that we were going to convey. And when I started doing the stand-ups alongside the Prime Minister, every day, 11:45, either in person or on a teleconference, we would be talking through what were our key messages for the day, and her comms people would help to shape those in a way that, as you say, as turning scientific principles and issues around risk into things that the public could understand. And I think that you can't go past the value of really good comms staff who are expert at doing that. And I do want to pay a particular shout out to the overall comms effort, that the Unite Against COVID-19 and the extensive communications collateral that went out through so many channels. I was one of the people driving on virtually empty motorways into work every day, and you'd still the signs along the motorway would be exhorting me to stay home, save lives, and be kind. And we saw that go out through a huge number of channels. So again, the use of people with expertise to craft those nice, simple messages.
Thank you. Do you have any comment on how the communication strategies you used could encourage the team of 5 million to address the issues raised by Marissa, particularly with regard to equity and social justice and fairness?
Oh, well, I don't know if I've got any clever ideas there, but I think, and I really enjoyed the presentation. These are issues that are fundamental to public health and fundamental to the work we're doing here in the ministry. There are lessons there, and I think one of the things we're trying to do is look at what happened in the health system and across government over those last few months, and particularly during the lockdown period, and the things that happened that would have otherwise taken years to happen, and why was that, and so that we can retain and amplify those. And a good example is, one of the key bits of feedback I got from district health boards that had been profound for them through the lockdown period was how strong the relationships were with iwi and their ability to act quickly to support Māori communities. And you know, it's interesting in hearing that, because there's nothing stopping them doing that. In fact, it's an obligation that's on them in the legislation already. So I think that we've taken some lessons from that about most of the barriers to actually addressing these issues are a failure of our imagination. They're not barriers, they're not actual barriers, and most things are possible, and we should not revert back to where we were. We need to make sure we are not asking for permission. As my boss said to me recently, just keep doing stuff until someone tells you to stop, and if it's working, no one will tell you to stop.
That's probably true. Dr. Bloomfield, thank you for being a reliable point of information and communication over these past couple of months. How did your team decide on what findings to convey to the country?
Well, a couple of comments there. Yes, you don't want to overload people with information, and you don't want to, and you know, there was some commentary that we were trying to control the narrative. So you've got to be open, and I guess part of the challenge and the approach we took was we would share, here we think of is the key information people need to know, but in making ourselves available, and I was making myself available from early on to answer questions about all sorts of things, and in preparing as well as I could with the latest information, I could answer those questions. And sometimes if I knew there was an emerging issue, I would front foot that in my opening comments. I would say, I've read a story about X, and here is a view on that, or there's people have been commenting that at X, then here is, I just want to front foot that, and you will all recall that. In fact, I spent several weeks, celebrating every time I got through a stand-up without a mention of PPE, because that became the sort of term du jour, and there was a lot of interest in it. And so very often it was trying to front foot issues that I knew were emergent, or where there was concern, or where there was public commentary on them. So you have to strike the right balance by providing information that is reassuring people, but not providing creating any perception that we're trying to sort of astroturf things.
Thank you. The daily stand-ups were very effective, and would this possibly be something that you may continue across other health conditions? Perhaps not daily though. And then a comment, thank you for your amazing work.
Well, thanks for the comment, and I want to just kick that straight to my team. And I've made this comment publicly a lot. Just being surrounded by great people, it's a team effort, and going. I'm still really nervous before I go and do each of those stand-ups every day, and I prepare well, and my team give me great support there. So I need to acknowledge them. Yeah, we've talked about how we can get that communication much more regularly out from the ministry on a whole range of issues. I've deliberately, until at least the last few days where it's been the right thing to do, I've deliberately been stepping back for a couple of reasons. One is that, and you will have seen some of the public kind of response to that, of course, when someone's out there very visible every day through what is, a hugely significant and symbolic event in everybody's lives, then you get this sort of the person can become the focus rather than the issues. So one of the reasons I've stepped back is that, actually, as I've always said when I'm asked the question, is actually I was just doing my job to the best of my ability, and what people saw through me and through other things was the public service doing its work incredibly capably. And that's not usually seen or understood, and here it was much more visible. So it's been a deliberate step back. So there's been less focus on me as a person, and more just, well, that was because of the time and circumstances, and I was and continue to do my job. But also, of course, as we get closer to the election, I started to and will continue to field somewhat more political questions, which are not for me to answer. And so it's much easier if I'm a little bit away from the daily stand-ups. But after the election, certainly we'll be thinking, and already are thinking, much more about actually how can we communicate much and use the platform we have created through our response over the last few months to tap into the public's interest in public health issues. And I guess just a final comment here, because it's, I think, germane, the thing that probably surprised me, or not surprised me most, but that I took away, the biggest learning for me from the public's response and the way they acted so collectively during the lockdown was how much importance, actually, at the end of the day, people place on feeling safe and the government looking after their safety and well-being. They put that above everything else, and I think that surprised people, and maybe it shouldn't be a surprise, but above all else, the people want to feel safe, and they want to feel the government is looking after their and their family and their community's well-being, and that became really obvious. And I think there's something there for us. We should not underestimate the strength of that underlying feeling that is out there across our country.
Thank you. And how have you managed your own health and safety during this time? Did you arrange to have the occasional day off?
Well, people may recall it. When I did take a day off, it became a bit of a story in itself. Look, that's been a real challenge, I have to say, because, and it's not just for me, but staff here have been working, some anyway, been working really long hours, and looking after one's own physical and mental well-being is imperative. Actually, and I think maybe many other New Zealanders found this, the lockdown was a real reminder to us about how much pressure and stress we put on ourselves through how frantic we are in our days, you know, and how actually just slowing down and stopping and pausing and listening to the birds and going for a walk when we were forced to do it was so good for our well-being. Now, of course, for many people who were essential workers and their families, it may not have been the same, and I'll acknowledge that. However, it's been really, I think, that was something that was an amazing learning for me, and we were again surveying the population, and anxiety amongst those surveys, anxiety declined during the lockdown period, partly I think because of the certainty it created for people, but also people's mental and physical well-being probably collectively did improve. I certainly loved the time when I wasn't at work with my family. I can just remember warm, sunny lunches on the back steps, hearing nothing but birds, and going for bike rides with the whole family, being able to walk down the middle of the road because there were no cars when we were going for a walk. So that was helpful. The last few weeks, the pressure's been pretty intense, and I did notice that the cumulative intensity of it had started to get to me. And I came into work one day, and I didn't have a stand-up, and I had a really light day, but every time I looked at my diary, I could feel my anxiety levels just going almost stratospheric, because it was this anticipation of I had a stand-up or something, and I realized I needed to just pause and take some time out. Took a few days over Queen's birthday, but you know, that cumulative impact of high cortisol levels, of the uncertainty of grappling with really significant issues does catch up on us all, no matter how resilient we are, and we do have to maintain our own physical and mental well-being. It was a great reminder, and emotional and spiritual well-being.
Too true. Who came up with the bubble concept?
I wish I knew. The closest I've got to it is actually a letter that we sent to the University of Otago. I sent to the Vice Chancellor, and in that letter it suggested that Dr. Tristram Ingham, who's a researcher, disability researcher and advocate, Māori researcher in Wellington here, had come up with it. I'm not sure, but I think it's been a fantastic concept, and we've seen other countries also now start to adopt that idea.
Okay. What public health communication advice would you give to the US, possibly?
Well, it goes a bit beyond public health communication advice, I think. Look, I'd just come back to those key things about, you know, what worked well for us here was that consistency of the messaging and establishing that trust relationship with the public, so that even if the news wasn't that flash, and you know, people will recall we went to alert level 4, people had to trust us when we'd say the numbers will keep going up, but after a week to 10 days they will start to come down. And of course we're all holding our breaths, although those of us, there'll be some on the line who, those of you who are communicable disease specialists, we know that actually if you do it right, that this is what will happen. So for the US, and it's not just the US, I think it's really that critical thing about that strong, consistent and trustworthy political leadership is so critical to both a successful and an unsuccessful response. And of course, you need politicians then who are genuinely driven by a desire, a paramount desire to secure the well-being and safety of their citizens, and not some political or other personal agenda.
Thank you. And I think we'll just end with 2 comments, and you don't need to respond. This is just another note to say thank you, Dr. Bloomfield, for being a true leader during these times. You've been an excellent communicator with a reassuring presence. And as 3 Kiwis of 5 million, thank you. Also, just want to let you know how much of an impact you and your team have had on our younger New Zealanders. Your communication style has been key in comforting our children. Thank you.
Well, thank you for the feedback, and once again, thanks for the opportunity to participate in the seminar today. I hope that that's been of interest, and really appreciate your ongoing support, and I'll pass the feedback on to my outstanding team here. Kia ora koutou.
Thank you very much, Dr. Ashley Bloomfield.